The gamma-tile technology is something that is different from all other forms of external radiation that we need to talk about. Traditionally, external beam radiation has been used to treat targets and tumors of all different shapes and sizes in the brain. The basis of the radiation is that radiation sources are placed outside of the brain and the radiation goes through the brain to the target. The downside of that is, of course, that the brain, normal brain, gets a healthy dose of radiation, and that may have consequences for the function of the brain. And there is a tolerance limit to how much radiation the brain can take. The way that traditionally have been used to get around that is something called stereotactic radial surgery, where multiple beams come in through multiple angles to hit a small target. And that's the key. The small target is the limitation of that particular technology. The limit of targeting is about 3 centimeters or smaller. Larger fields of tumor and resection cavities are not treatable with this particular kind of method. Up until recently, that has been the limit of what we could do. However, recently there has been a development of something called gamma tiles, which I have a sample here. The gamma tile is a form of what we call interstitial brachytherapy radiation. And what we do with this is that during a resection where a recurrent tumor may have come back in a patient, we remove the tumor and then we line the cavity with these tiles. Now, these tiles are composed of a collagen matrix with embedded seeds, and the seeds contain cesium-131, which is a gamma emitter. So once the tiles are in place, the surgery is terminated, and the seeds will continue to shed radiation into the tumor bed as the patient continues to heal from the surgery. This does not allow any radiation to go into the rest of the brain and cause toxicity, and so this is an additional way of adding more radiation treatment to patients that we have to treat that have possibly hit their limit on external beam radiation. Thank you for viewing.